We welcome everyone here on this sad occasion. We appreciate your attention. We'll share what information we can about the events of yesterday and what Hennepin Healthcare has been doing in this space. It's a tragedy. It's hard actually to come up with words to describe it or to fit the moment, but this is a horrible, unspeakable event that affected our community, affected our workforce, and obviously affected those directly involved. So our hearts go out to the folks that are directly affected. At Hennepin, this is what we do. We're a trauma center. We take care of the worst of the worst for injuries. So this is part of our daily work, but we're also human. So my teams are providing great care, and we'll give an update on events and conditions. But know that we feel pain along with our community in this circumstance. Specifics about folks that we're caring for: we currently have 9 patients that were involved in the shooting yesterday. 6 of those patients are in satisfactory condition. 5 of those patients are children. We have 2 patients in serious condition, 1 adult and 1 child, and we have 1 child in critical condition presently. That's about all the detail we'll be able to give out of respect for patient and family privacy. So I'm going to hand off to Marty Shear from our EMS services to help walk you guys through the events and the perspective. Thanks, Marty.
Good morning. My name is Marty Shear. It's Martyscherer. I'm the EMS chief for Hennepin EMS. I'll try to maybe answer a little statement, answer some questions that you want me to, Chris. From the EMS perspective, things went as well as they could be expected. We trained for this, and things went well on that part. But no matter how much you train for it, it's still really difficult on the team. I think there's a lot of maybe unrecognized heroes in this event, along with the children that were protecting other children, which is really amazing to hear about. I might be saying too much, but we had one kid that covered up another kid and took a shotgun blast to his back and things like that, and they were helping each other out. So the teachers were amazing. The teachers were, getting shot at. They were protecting the kids. They took all the kids outside to an area of safety. Witnessed all this happen. The teachers were amazing. The kids were really upset, obviously, but they really did a great job of keeping the kids together, keeping them calm, and then taking them to an area of safety and really working with the parents. So the teachers were amazing. They're great. Minneapolis police was amazing. They entered the building. Their objective is to neutralize any shooter in there, and they did it without hesitation. They went immediately to the building, which is amazing. That doesn't happen everywhere. So Minneapolis police deserve a lot of credit for this. They also gave us a really good report of we have potentially 20 patients in there, and that helps us in many, many ways. We notified the hospitals what we have coming, and we try to separate some of our patients. So we take many of the patients that are critical to Hennepin, the level 1 trauma center for pediatrics. Then we take some to the children's hospital there, less critical, and then we took some to North as well. So our whole team, our surgeons, the ED, everybody did a fabulous, fabulous job. But yes, it's really still tough on that team. Some people have asked, how do you triage the patients on the scene? So it's a really quick, with in situations like this, it's pretty quick if they're conscious or not. If they have gunshot wounds to the upper body of the head, they're obviously red patients. Other people are going to be yellow patients. We try to load up 1 red patient, maybe 2 or 3 yellow patients in an ambulance, take them to the hospital. That all worked really, really well. Great response from our police, fire departments, and other EMS services. And like I said, we train for this. Most of us all have kids, though, so it's still really, really hard for our team. But they're doing pretty well. We gave most of the people the day off today that were there yesterday, but they'll come back to work and do the same thing over again. So should I answer questions, or should I save that for later? Yeah, questions later. Thank you.
Good morning, everybody. My name is Dr. Aaron Robinson, Aaron Robinson. I'm the assistant medical director at Hennepin EMS, and I'm also an emergency physician at Hennepin Healthcare. Yesterday was an incredibly tragic day. The medical directors were paged out a couple minutes after this had happened. And part of our job is to relay information and be a liaison between the hospital systems and the providers on scene. The earlier you activate a mass casualty incident, the better. We can mobilize resources faster, and we can get the folks and the equipment there that are needed to help best care for our most critical trauma patients. When I was en route, I contacted EMS Command, and they had information from police that were going to be upwards of 20 victims or more. With that information and the resources that I knew that Hennepin Healthcare had provided, I activated the MCI within a couple of minutes after knowing that, just to get resources mobilized and to get the folks there that needed to be in the upstaff our emergency department for patients to be received. In trauma, when you're talking about caring for a trauma patient in the pre-hospital setting out in the field, minutes and seconds matter. And our job in the pre-hospital setting is to perform life-saving interventions like stopping the bleeding or helping somebody breathe. But every minute that a trauma patient spends on scene increases their chance of not having a good outcome and possibly dying. So I have a huge credit to the Minneapolis Police Department and the other first responders that entered the scene and secured it quickly. The scene was safe in a few minutes after the initial incident, and I credit our brave first responders for doing that. That allowed us to get the patients in and to get them to definitive care very, very quickly. Those swift actions undoubtedly saved the lives of many of those children.
Hi, everybody. My name is Dr. Tom Wyatt, W-Y-A-T-T. I'm Chair of Emergency Medicine at Hennepin Healthcare. You know, the emergency department is the front door to our entire safety net organization. And while we deal with emergencies every day, it takes a lot of planning, preparedness, exercises, drills throughout the year to deal with an event such as what we experienced yesterday. So it was really very, very helpful to us, as Dr. Robinson mentioned, to get that pre-notification of the types of the numbers and the types of injuries that we were going to experience. And that allowed us to mobilize the appropriate resources. Here at Hennepin, you know, as a level 1 trauma center, both for adults and pediatric patients, we're able to mobilize a lot of resources very quickly. Luckily, this happened during the daytime and not the evening, so it was a lot easier for us to quickly mobilize some of those resources. The amount of resources and the amount of organization it takes to assemble those teams so that we can have a team ready for a patient when they come into our emergency department, when they arrive via EMS, is very impressive. And as I stated yesterday, I'm really proud to be part of this organization and all of the different components of the teams that we had yesterday. I listed some yesterday, and I know I missed some people, so I won't try to list them all, but there's a number of different specialists that come down to help us for these types of events. After the MCI response was over, as emergency providers, we unfortunately don't get to stop what we do. We have to continue working. We have to continue to see the patients that are continuing to arrive to the emergency department. We have to continue to work the shifts that we are already there for, and that can take a toll as well. Once you try to process what you experienced in a mass casualty event such as this. So again, we received an outpouring of support from the local communities from across the nation. I've received messages and support from chairs of other emergency departments across the country. It's just it's been very meaningful to us and our teams. So thank you for that. I want to introduce Dr. John Gakin, who's one of our head trauma surgeons.
Hello, everybody. Thanks for coming today. My name is John Gakin, one of the trauma surgeons, Jon, G as in George, Ayken. A lot has been said and a lot has happened over the last 24 hours. And the impact of yesterday's events will be felt throughout this community, through the country. And most notably through our hospital organization and the people that I work with. But I think it goes most importantly to be stated that this is really about the families and the people that are impacted at the shooting yesterday, and that we are just here to support them. I think the main message that I can portray is that, we like to stand here as a hospital just sort of quietly waiting and being ready for whatever the hospital or the community needs. And unfortunately, yesterday is something that I didn't think I would ever have to be part of. so I don't really have good words to describe it. But everybody in this hospital and this organization was there, and down to the EMS, or the housekeepers, the nurses that weren't even part of the. I'll tell a quick story because it emphasizes it. One of the victims came in, and in the emergency department, this was a nurse manager from another unit, didn't have anything to do with what we would normally respond to. And one of the children were very scared and alone because everybody was running about and doing their jobs. And she went into the CT scanner with the patient, putting herself basically in the harm's way of radiation, which normally would evacuate the room. She put a little lead on and stayed there and held her hand and held her hair while she went through the scanner so she didn't have to go through it alone. Those are the types of things we witnessed yesterday. I don't know that we can describe what they went through and what the actual events were like, nor I think we're supposed to be able to do that. But we can describe the things that we saw from our team members and from our hospital. And it was as inspiring, as preserving for me as I can put words together. Taking care of one child that's injured is difficult. 8 of them is nearly impossible, but it happened yesterday. And so the teams that came together, that worked after the patients went out of the emergency rooms and they were triaged, the pediatricians, the neurosurgeons, the therapists, the pharmacists, sure I'm missing the medicine doctors, the other surgeons from other hospitals, our team, the outpouring of support from friends and family, past residents, past medical students, people of that just know what's going on. So I can't say enough other than thank you for the support. Our teams will need it.
Okay, and we'll answer some questions if anybody has some from anybody here.
This may show naivete, but at one point you had 10 patients coming in with gunshot wounds. I think you said about 4 of them needed surgery. I would almost assume 10 patients with gunshot wounds, all of them need surgery. What differentiated those that stayed in the ER for treatment and those that were able to, that required surgery?
I'll jump in right. One thing we're really blessed with here is our surgeons come down to the ED right away, and so I'll let the surgeons talk about it, or maybe.
Yeah, I
Dr.
think
White.
the way the trauma process in our hospital and many around the country is, the patients are met and greeted. EMS gives updates to the emergency department physicians. They have an opportunity if they think that something is going to be might require surgery, or if something develops when surgery is needed. But yeah, as they activate us, we come down and we work together. So it's the emergency department and our surgery trauma team interfacing with the patient and the condition together. And then once the decision is made that they have a surgical sort of need, we make efforts to get them to the operating room. So that triage process happens real time and together. But then once they go into surgery, we a lot of times we take them up to surgery. We do whatever surgery they need. And some gunshot wounds, to answer your question, don't always require surgery. Some can be managed what we call non-operatively. And those sometimes have to do with extremity injuries that don't involve blood vessels, that may not involve the bones, but sometimes they'll heal, maybe if it's not a fracture that requires orthopedic involvement. But there are areas of the body, the chest and abdomen, where need exploration, or sometimes in the head, of course. So there were some of those patients yesterday, and some required emergent operations, and they underwent that.
Can you give an update on the condition of victims?
I mean,
Yeah.
I'm going to leave that to the...
Yeah, I mentioned at the outset that we have 6 patients that are in satisfactory condition, 5 children. We have 2 in serious condition, 1 adult, 1 child, and 1 patient yet in critical condition who's a child. Correct. I believe 1 patient was discharged, yeah.
Yeah.
Started with 10.
Yeah, we're discharging 1, maybe 2 this morning.
6 in satisfactory, 3 in serious, and
2 in serious and 1 in critical condition.
1 critical. Thank you.
The 2 in serious are expected to survive?
Yes, I believe so.
As well as 1 in critical.
I think it's more touch and go. I'd rather not share more detail at the present. So.
I have a question for the doctor. Really appreciate you sharing, Lana Zach, CBS News, the story about a member of the healthcare team who was there just supporting children, because I think the entire nation is feeling the on the families, and I understand that a member of your team was both working as a healthcare provider and a mother. Can you tell us anything about the critical care pediatric nurse, Amy Jean Dreyer, and her actions yesterday?
We can't. I mean, our structure of how we protect patients and families doesn't allow us to comment specifically on circumstances. I'm sorry.
Understood.
Yep.
I just wanted to give you an opportunity to praise one of your own.
I would, yeah, I'm going to defer. I would say all the families are asking for prayers and support, so that's about as much as I'm willing to share.
We did have a number of people that have children at the school. One of our paramedics has a student there. I know several nurses have students there, so it was impactful for the whole organization. Yeah.
Thank you.
What was that initial response like? How many EMS personnel, how many ambulances, how many did you send out?
So the question is how many people responded to the scene. So initially it came in as the active shooter, so we activated Plan 1, which normally gets us about 6 ambulances and a supervisor and a doctor. But when we heard the 20 patients potential, then we go to Plan 3, which gets us about 20 ambulances, all of our medical direction team, everyone, and we have some mutual aid from other sources also back up our system. So we had a really, really great response. Our team was actually at Station 27, which is like 3 or 4 blocks away. And so we were ready to go. We waited for the police to give us the okay to come in, which took just a minute or two. And then we were on scene right away, and we started transporting right away. And I think we transported the first patient within less than 10 minutes of the call, the time the call came in. And then I think we're done transporting people after 25 minutes from the time the call came in.
With 20 ambulances, how many people?
I think we ended up using a dozen or so ambulances and transported 17, I believe is the number. The 3 different area hospitals. Other questions?
Can I just follow up
please.
on your point? Can you tell us more about how the community, and specifically here at Hennepin Healthcare, given the connection to the school, how they're dealing with this?
I can't speak. Everyone deals with it individually differently, but I know our team is really resilient and strong, but you can train for this all you want, but ultimately it's still really challenging with little kids. Yeah, it's hard.
Yeah, we would add, in terms of grief and handling trauma, it's day 2, 3, 4, 5, 6, where it starts to slow down and those deeper thoughts start to come. So we're supporting our teams. They're heroes over there, but they're human also. So.
Yeah, and we have a great mental health resources as well. We have our psychiatric people come and met with the team. We do a hot wash. We have them chat with all the individual providers. We have other mental health resources in there. But it's usually, days or weeks later that really kind of hits home to everybody. And so we'll see how it goes. But, with the kids, it's just, once again, a different element of the process that makes it more challenging. I think kids, and also when you get other first responders that are injured, that also is challenging. So, but I think overall our team's doing really well. We have a lot of trauma that happens and a lot of gunshot wounds. This one is just a little bit different, though. Other questions for anybody?
Could you address some of the efforts that were made on site in terms of life-saving measures that made a difference in terms of timing to get the patients to the hospital?
Sure, I'll let Dr. Robinson address that.
Yeah, and beyond the overwhelming majority of these shooting type scenarios, police are the ones that actually apply the tourniquets. That is a major key in trauma care to stop the bleeding. When we're dealing with a trauma patient, the first step is to stop the bleeding because they're not going to survive if they continue to bleed even for a few minutes. So the first couple steps is applying tourniquets to extremities to stop the bleeding, and then applying pressure to other wounds that are maybe in the torso or in the trunk, as well as applying seals over any holes that we might find in the chest from bullets or knives or anything. Those are the key things for initial life-saving measures, followed by helping people breathe if they're not breathing effectively, and then transporting them to the hospital.
So specific to this, I know that you are not disclosing a lot of information in respect to patient privacy, but specific to this, can you talk about some of the things that were done that really made a difference, and what that time frame was?
Yeah, leaving specifics out of it, the really critical things that were done was bleeding was controlled quickly, and people's torso, those wounds were bandaged and packed very quickly. That made a key difference because we've got upwards of 20 patients that are potentially bleeding to death, and that's a lot of blood that is needed very quickly if we need to give those folks blood at the hospital. So big credit to stopping the bleeding, and that'll happen within 1 or 2 minutes of police getting on scene. After they secured the scene, they were the ones tending to the victims and applying those life-saving interventions.
I'll jump in and add a little bit. I mean, time, it's like Dr. Robinson talked about time. So we're pretty blessed here. Listen, our crews got there quick. We transport the hospital quick. They get to the ED quick. The surgeons are there quick. Ultimately, they need surgery. They have to sew up the areas that are bleeding. And so the quicker we can get them to surgery, and our surgical team is really the key. They talk about the golden hour. It's not an hour. You don't have an hour. You have minutes. So the team did great.
When you have a victim who is a bigger body mass and they are hit with gunfire, that's one thing. Of course, it depends on where they're hit. But when you have a child and it's a smaller body mass, can you talk about the scope of devastation when it's a child?
I mean, I think, so the psychological aspect, I think I mentioned a little bit earlier, how, managing one child is difficult. Managing a multitude of children at the same time takes an enormous amount of resources. But I think, if you're talking specifics about like ballistics and the injury, am I getting your question? Like you're talking about what the bullet does to the specific body part?
Not necessarily, just that, you have a smaller body mass and a bullet.
Yeah.
And on the smaller body mass, the potential for the devastation is
Yeah, so children, when they're injured, have a unique ability to sort of maintain their circulation and their life, sort of like their blood pressure and their heart rate and stuff, keep themselves alive until they don't. So adults are a little bit more telling. Children are seemingly, they sort of are kind of plugging along, and then all of a sudden they're not. And talk a little bit about the minutes and seconds and sometimes matter. But in these circumstances, I mean, one bullet wound to a chest in a child, if it's in a place where there's big blood vessels and things that could end your life quickly, there's not as much room for error. And so you have to, evaluate them quickly and manage them efficiently and fix basically the holes that are made from the bullets. But as far as I don't know if I'm answering your question correctly, but the stakes are a bit higher. I think would be the answer, the short answer. Yeah.
Please, go ahead.
Given the number of casualties, how remarkable is it that we are not hearing about more fatalities?
Yeah, I prayed about that on the way in yesterday when we were working on it, about how this was going to work out and what this was going to look like, because there were a lot of gunshot wounds in places that were meant to kill people, and if there is such a thing as a silver lining to this, there was less casualties than what possibly could have been. So there could have been, it could have been a lot of fatalities, and it doesn't take away from the pain that those that did not survive are going through, but this was meant to kill people.
I'll just add, I think that also it's really a testament to the system, the trauma system that we've built in this organization.
I would also say that the training that the kids did surprisingly paid off. They all laid on the floor, they covered each other up. That was key.
Yesterday, I asked police about how many kids or people were in the church when this happened. They're still trying to figure out a rough estimate, but for you that were at the scene, any idea of how many people were there, at parents or kids or parishioners that might have been in the church?
I think there was a few hundred. I think there was every class which is about 15 plus people, and it's kindergarten through 6th, 7th grade, something like that. And then there's teachers, there's other prisoners in there, there were some parents in there. So I can't give you a clear number, but it was full. It was a lot of people. Yeah.
If I may ask about, you mentioned blood loss and blood supply. Memorial Blood is getting a lot of calls from people who want to donate and are actually having to kind of manage it right now. I wondered if you could speak to the blood use and the need for blood.
Dr. Robinson?
Glad you mentioned that. There's actually a critical blood shortage right now in the state of Minnesota, and I implore everybody that's available to please donate blood, so we have it available for sick trauma patients and other people that need emergent blood. There's a critical shortage, and we have a few days on hand in the entire state. So please donate blood. The amount of blood that gets used in the ED, I'll defer to Dr. Wyatt and Dr. Gagan, as I wasn't in there at the time.
I can't comment to the exact number of units of blood that we pull from our own blood fridge in the emergency department, or the units that we received from our blood bank, but it was pretty substantial. I'm not sure about the operating room.
I mean, we use blood in the operating room. I don't know the exact number, but the thing, to echo the points, is that it's we're still using blood. So it's not just the morning of; it's ongoing.
Other questions? Chris?
Thanks. We can continue to ask more questions. I just wanted to mention, too, right here in this room yesterday is where we had our reunification center, right here in this room yesterday for families. The center was established right here as they waited for news about their loved ones, and staff to bring updates from right across the street in our emergency department. And I want to recognize the really special team we have that specializes in caring for our gunshot victims and their families. And that's our Next Step program. Can you guys please stand? Yesterday when we talked about some experiences and things we saw, I saw firsthand in this room yesterday some of these team members, and can you just, if you guys were here, some of these guys, I saw them holding hands with families and praying with them, and it was just amazing, the work that this team does, and I just want to recognize you guys. It was just so touching and being there for them, so thank you for all the work you do. And if anybody wants to talk to them about the incredible work that they do for our patients, I just encourage you to talk to them. I don't know what we would do without your team, so thank you guys so much. And our reunification process is part of what our trauma team does. They, sometimes our patients arrive and they're unconscious, obviously, and they can't tell us who they are. And in situations like this, we need to figure out who they are and contact family members. And so when there's a mass casualty event, you guys can explain this better than me, I'm sorry, but we need to figure things out, and we practice this. And when we practice this for events. So these guys can talk about it better, so I just wanted to bring that up. And I also wanted to mention, and Amy Carlson is with our foundation, we've had such a wonderful outpouring from our community members, and we want to thank everybody for that. For our families, they are so grateful and appreciative. And there's a website that people can go to, and it's up today, and it's hennepinhealthcare.org/sharingthecaring, and it's if anybody wants to contribute, and that's a place you can donate. Is that correct?
It is hennepinhealthcare.org/love.
Oh, that's even better. hennepinhealthcare.org/love. And
You can leave messages, and there's also ways to show your financial support to specific areas of the hospital affected in the strategy.
yeah, and we just want to thank the community for their support for these families, what they're going through. Sorry, I didn't mean to interrupt. But
I'll address that too. At the scene, that was one of the bigger challenges that didn't go as well as I would like it to. We transported 17 people. We were not able to identify all of them right away, so we were not able to let the parents know right away if their children were injured or what hospital they went to. And we'll have to figure out a better way to do that. I think that was very, very challenging, especially for the parents. I know parents were driving from hospital to hospital to hospital, and that had to be horrible for them. So we'll try to figure out a better way to do that. But that's something that's, because kids don't have IDs on them, we don't know who they are, and it's just a challenge. Anything else, anybody? Otherwise, thank you all for coming here. We'll be around if anyone has questions, too. Anything else? No? Okay, thanks.